what is the difference between initial action and first action. All right, there's not much difference. It's basically the same. Initial or first action, the only thing that is indicating to you is that you're dealing with a prioritization question. Now, this is important. If you're dealing with a prioritization question, you have to use a priority strategy. Priority strategy like, for example, assessment versus implementation, Maslow's hierarchy of needs strategy, the SAR method strategy, when to call the doctor strategy. You have to use a prioritization question, because when you're dealing with a priority question, the only thing you're using is content, you're probably going to answer incorrectly. Because remember that priority question, most of the answers are correct. Usually, all of the answers are correct, but you need to identify what is the priority. And for that, you need to use a prioritization strategy. Okay? What advice do you have for a repeat test taker? Excellent question. If you've taken the NCLEX before and you failed, the first question that I want to ask you is, how did you fail? Did you fail with the minimum questions, 85? Or did you fail with the maximum questions, 150? Because that's going to make a difference on when you take the NCLEX next. You may think, Professor, isn't it the same? If a failure is a failure, a fail is a fail. No, it's not the same. If you've taken the NCLEX and if you failed with the minimum questions, usually what that means is that you're very weak in content and critical thinking. If that's your case, I wouldn't suggest taking the NCLEX at least for 3 months. You need to practice questions, you need to develop your critical thinking, improve your knowledge, and it takes time, okay? However, if you've taken the NCLEX and you failed with the maximum questions or close to the maximum question, what is usually happening is that you're hogging the passing line. What that means is that for the most part, your nursing knowledge or content is not too bad. What you need to focus more is on developing critical thinking, learning prioritization strategies. That way, when the priority question comes, you can answer correctly and stay above the passing standard. For those students, usually 45 days is sufficient to prepare for the NCLEX, okay? Is it okay to choose only one answer in the NCLEX for a select all that apply question? Okay, is that correct? Yes. Are you gonna find select all that apply questions that only one answer is correct? Can it happen? Yes. You can have a select all that apply question that only one is the answer, or all of the answers are correct. But we go back to the select all that apply strategy that I taught about today. Only select the ones that you're sure. If you feel sure with one answer, only select one. If you feel sure with two answers, select two, and so on. If I have a priority question that is asking me what is the first thing that I need to do, or what is the best thing to do for the patient. Okay, that's a little bit different. It's not the same first versus best. When you see what is the first action to take, the priority action to take, the initial action to take, you're usually dealing with a prioritization question. When you see what is the best thing to do, or what is the best action, that is usually a content question. Because on those type of questions, usually there's only one answer that is correct or that is the best. So it's not the same. It's not a priority question when it says the best answer to select. Okay, I failed my first attempt with 92 questions. What does it usually mean? Okay, so 92 questions is very close to the minimum. So it goes back to the scenario that if you've taken the NCLEX and you failed with the minimum amount of questions, it usually indicates that you are weak in both content and critical thinking. So you have to improve both. How many months of preparation do I need to pass the NCLEX? This is a very tricky question. It depends. It depends because some students, it takes them 45 days, about a month and a half. Other students take them 3 months, and other students take them 6 months. What is the average, I should say, or what I see most commonly in the 7+ years that I have been teaching students to prepare for the NCLEX? I have seen that the average is about 3 months. That's about how long it takes. However, if you have problems with the language, if English is your second language, you not only need to learn how to prepare for the NCLEX, but also you have to overcome that language barrier. It could take you closer than 6 months. That's why I say it really depends on your specific situation. Okay. Do you have an LPN to RN bridge program? No, we are not a university. We are a private tutoring company. So basically our focus is to teach students how to prepare for the NCLEX. We're not a nursing college or university, okay? Very good question here. How many, or what is the percent in my question bank that can predict my pass? Ooh, that's a tough one. Okay, several factors. One, it depends on what question bank you're using. Some question banks are better than others. Some question banks, the questions that they have created doesn't really prepare students for the NCLEX. But let me comment on, I should say, two of the most well-known question banks that exist, two of the ones that I believe are one of the best, UWorld and Kaplan. UWorld and Kaplan, if you're averaging about 65-70%, you're doing pretty good. If you are also getting high probability of success on the CATS, the computer adaptive test, usually a good indicator that you're ready to take the NCLEX and pass. Is it always like that? No, I cannot generalize, but it's an average. But another key factor to take in consideration is that, is it the first time that you're doing that question bank? Because a mistake that I have seen students make is that they do a question bank twice. So they go through the questions, more than once, and then they're doing tests and they're getting very high scores, but it's a fake score because you're memorizing the answers. In those scenarios, then you're not really prepared. You're just remembering question. And with this, I give this tip. Remember, do not memorize questions from a question bank, because you will not see another question like that the day of your exam. NCLEX has a specific question bank in their database, over 300,000 questions on their database. That way, every student, when they're facing the NCLEX, each one of them are facing a new question. Now, Are the topics similar? Is it the same nursing content? Yes, but just described differently in the different scenarios that you're going to be facing.